Hi, welcome to this brief webinar titled Implementing Prevention Plus Wellness Programs, Step 1, Screening Current Health Behaviors. My name is Dr. Chudley Wirch. I'm founder and president at Prevention Plus Wellness, LLC. To start out with, I wanted to highlight the fact that all of our Prevention Plus Wellness programs are based on a screening and brief intervention model. This model is referred to as SFGF, which stands for Screen, Feedback, Goal Setting, and Follow-Up. This practice framework is, as I mentioned, used for all of our Prevention Plus Wellness programs, and the first step in this model is to screen individuals for their current health habits. We'll discuss the other 3 steps in the following webinars. Some goals to keep in mind when thinking about screening is that, first of all, one screen purpose is to trigger current health behavior awareness and awareness of positive images associated with engaging in particularly the wellness behaviors that are discussed in our Prevention Plus Wellness programs, whether that be physical activity of different types or sports, eating healthy, getting sleep, controlling stress, or what have you. Another goal of screening is to provide the data by which we tailor feedback and also tailor the multiple behavior goal setting for participants. And lastly, screening serves the purpose of allowing us to collect pre-post test data of which we can assess changes on a measure of willingness to engage in future health behaviors. Some rules to keep in mind for successful screening. First of all, you have 2 implementation options with all of our Prevention Plus Wellness programs. One is to implement the program as they were originally devised and developed and evaluated, and that is one-on-one as an individual coaching type session, or you can use the protocol to implement it to groups of individuals. You want to implement your screening survey in a private setting if you are implementing it one-on-one, so that you protect that sensitive information that you're talking about and collecting from your individuals. So use a private, quiet setting, or at least a semi-private setting, so there aren't people walking by that might listen in. If you're in a classroom and implementing the program in a group setting, of course you want to have seating set up so that there's enough space for individuals to protect the responses that they're completing on their screening survey. To implement the screen, simply follow the one-on-one or the group script to implement the screen. Participants will be asked to answer the questions about their health and fitness habits honestly. And in fact, they will also be told not to place their names on the screening survey to encourage them to respond freely and honestly. Now, if you wish, you can collect the screening surveys along with the feedback forms, which are typically implemented immediately after the lesson, to assess immediate pre-post-test changes on willingness to engage in each of the target health behaviors. In other words, you can, in a single setting, collect an immediate pre-post-test assessment, and the willingness measure is very highly correlated with actual behavior in the future. So it's a very practical and, as I mentioned, convenient way to collect this pre-post data in a single setting by collecting the screening survey and the feedback forms, which have the identical willingness to engage in health behavior items. So you're going to be able to assess all of the target behaviors by collecting the screen and feedback forms. If you need to, you can have your participants place a code to protect their anonymity on the screen and the feedback form. That could be as simple as asking them to put their, for example, their cell phone numbers on. But if you keep the screens and the feedback forms together for each individual, they don't even need to really include a code number on them. Here's a picture of someone perhaps implementing a screening survey. Most of our screening surveys are implemented with paper and pencil forms, although some organizations have translated those into electronic data collection tools. For more information about any of our brief evidence-based programs which unify prevention with wellness, you can go to our website at preventionpluswellness.com or email us for more information at info@preventionpluswellness.com. Feel free also to call us here in Jacksonville, Florida. Our phone number is 904-472-5022. Thank you for listening.